Today the topic we are going to discuss is epilepsy, and this is from Davidson. The true definition of epilepsy is a neurological disorder characterized by a predisposition to recurrent, unprovoked seizures. Seizure, you can see picture of Julius Caesar next to it. Seizure is occurrence of signs and symptoms due to abnormal hyperneuronal activity in the brain. This can result either from increased activity of excitatory neurotransmitters like glutamate or decreased activity of neurotransmitters like GABA. Imbalance between these two, like GABA decreases, so inhibition decreases, and glutamate increases, so excitation increases. Both can lead to the increased brain activity and thus can cause seizure. There are two main types of seizure. Number one is focal or partial seizure, and number second is generalized seizure. Now for simplicity, we will call focal seizure as partial seizure. Partial seizure with awareness is called simple partial seizure. Simple partial seizures are usually brief, lasting less than 2 minutes. There can be motor signs such as movement of body, vocalization or speech arrest, or sensory signs such as visual, auditory or olfactory changes, psychic signs such as sudden fear and anxiety, or autonomic signs such as dizziness, sweating or tachycardia. Partial seizure with impaired awareness or unconsciousness are called complex partial seizure. Localized disturbance in one area of the cortex exhibiting symptoms related to that, as I mentioned earlier, that they can be autonomic or they can be related to the movement, and this can be due to a tumor. Partial seizure may become generalized seizure if it spreads wide in the brain and causes secondary generalized seizure. Generalized seizures can be due to widespread brain neuronal activity, and they can be tonic-clonic, absent seizures, myoclonic seizures, or atonic seizures. Now tonic-clonic seizures or grand mal seizures, it has two phases. Number one is tonic and number two is clonic. For tonic we have tonic vodka, and for clonic we have a clown. Now in tonic phase, from the name tonic, the total tone of the body increases, and number second, the tonic vodka that you drink can make you lose your consciousness, so you lose consciousness in this phase, and it can make you urinate more, so you have increased urination or the patient urinates, and tonic vodka drinks gets you high, so you have a high cortical activity in this phase. So in tonic phase, due to increased tension, we have contraction in all the muscles of the body. Next is clonic phase, and for that we have a clown, and this is the convulsions, the jerking movement in the clonic phase. Alternate contraction and relaxation of the muscles. You can see the clown with the jerky movement, so it moves and comes back to normal. So clown cortical activity is between high and low. Also the clown laughs, so it can cause frothing and tongue bite in this phase. Now you can see the clown is bigger than the vodka glass, so duration of clonic phase is greater than the tonic phase. Clonic phase is for 2 minutes and tonic phase is for 30 seconds. Post-ictal is the drowsy, exhausted and sleepy state of the patient after the attack due to very high neuronal activity. Next is absent seizures or petit mal seizures, and this is in childhood or juvenile state, and there is always an MCQ scenario telling you that there is a daydreaming and school going child, and in childhood the most common is 3-second spike and wave pattern, and in juvenile we have polyspike and wave pattern. Now for the word absence, we have A, which is made up of 3 lines, so we have 3, and for B we place the slash here, and for S we have second and spike and wave pattern. Next we have is a myoclonic seizures, and this is brief jerky movement in the arm, mostly lasting a second, and this is in the juvenile age, and we have polyspike, wave and photosensitivity. And at last we have atonic seizures, in which there is loss of whole muscle tone of the body, resulting in loss of consciousness and falls, and this can result to head injury. Investigations always include detailed history and examination to rule out any secondary cause, EEG, which is electroencephalogram, MRI, CT scan, and blood test to rule out any metabolic cause like electrolyte imbalance. For treatment, we will only discuss the first line. For partial seizure, we have lamotrigine. For generalized tonic-clonic seizures, we have sodium valproate. For absent seizures, we have ethosuximide. For myoclonic seizures, we have sodium valproate. For pregnancy, we have carbamazepine, levetiracetam, and lamotrigine. Withdrawal from drugs is considered when the patient is seizure-free for more than 2 years. On next page, we will discuss visual mnemonic for this treatment. So in picture, first you can see is that we can only see the half limousine. So for half seizures, focal seizures or partial seizures, we have always lamotrigine. So for limo, we have lamotrigine. Next we have is a clown with a drink, and he is offering a child with pain in his arm. So for clown and drink, we have tonic-clonic seizures, and for the child with pain in his arm is myoclonic seizures. And the clown is asking, drink it, it will evaporate. So for both tonic-clonic and myoclonic seizures, we have sodium valproate. For valproate, we have valproate. Now in absent seizures, we have a scenario, daydreaming. So daydreaming, that's acid rest. So in absent seizures, we have ethosuximide. And last, you can see pregnant lady is craving carbs. So she is saying, I need my carbs. So carbamazepine is for the epilepsy in pregnancy.